Genital warts, scientifically known as Condyloma Acuminatum, are a sexually transmitted infection caused by certain strains of the human papillomavirus. Genital warts appear as small, flesh-colored growths or bumps in the genital or anal regions. They can vary in size and shape, often clustering together in a cauliflower-like appearance. If they are in clusters, they might resemble a cluster of grapes. These warts can be raised or flat, and they are usually painless. Some people might experience mild itching, burning, or discomfort in the genital or anal areas where the warts are present. While genital warts are usually not painful, they might cause pain if they become irritated or if they are located in areas where friction occurs, such as during sexual activity. In some cases, genital warts might lead to an unusual discharge from the genital or anal areas. There are over 100 different types of human papillomavirus, but only a few strains are responsible for causing genital warts. The primary strains that cause genital warts are HPV-6 and HPV-11. The virus spreads through skin-to-skin contact during sexual activity. It's essential to note that the presence of HPV doesn't always guarantee the development of genital warts, as the immune system can suppress the virus. Genital warts are primarily spread through unprotected sexual contact. This can occur through mucous membranes, which are found in the genital, anal, and oral areas. When there is contact between the genital or anal area of an infected person and the mucous membranes or broken skin of an uninfected person, the virus can be transferred. Unprotected sexual activity increases the likelihood of mucous membranes coming into contact with the virus, making transmission more likely. Genital warts are primarily caused by specific strains of the human papillomavirus. When you have multiple sexual partners, you increase your exposure to different individuals who might be carriers of the virus. This increases the likelihood of coming into contact with an infected person and being exposed to HPV. Some individuals infected with HPV are asymptomatic carriers. This means they carry the virus without showing any visible symptoms of genital warts. If you're sexually active with multiple partners, you might encounter carriers who unknowingly transmit the virus to you. A weak immune system can increase the likelihood of developing genital warts after being exposed to the human papillomavirus. Here's how a weakened immune system can contribute to the development of genital warts. A healthy immune system plays a crucial role in fighting off infections, including HPV. Normally, the immune system recognizes the presence of the virus and mounts a response to eliminate it. When the immune system is weakened or compromised, its ability to recognize and eliminate foreign invaders like viruses is diminished. This allows viruses like HPV to establish an infection and replicate more easily. In some cases, individuals with a history of HPV infection that has remained dormant can experience a reactivation of the virus when their immune system becomes compromised. This reactivation can lead to the development of genital warts, especially if the immune system is not able to control the virus effectively. Some medical conditions require the use of medications that suppress the immune system, such as those used in organ transplantation or to manage autoimmune disorders. These medications can increase the risk of HPV infections and hinder the body's ability to control the virus. HPV is present on the surface of the skin, particularly in the genital areas of an infected person. These viral particles can be shed and are capable of infecting other individuals through contact. The virus can enter the body through tiny cuts, scratches, or microabrasions in the skin. These breaks provide a pathway for the virus to reach the deeper layers of the skin, where it can infect cells and potentially lead to the development of genital warts. It can also be spread through direct skin-to-skin contact with an infected area, even if there are no visible warts. Vertical transmission refers to the transmission of infections or diseases from a pregnant mother to their unborn child during pregnancy, childbirth, or shortly after birth. Genital warts can potentially be transmitted vertically from a pregnant person to their infant. However, vertical transmission of genital warts is relatively rare compared to other modes of transmission. In some cases, if the genital warts are present in the vaginal or perineal area, there is a risk that the newborn baby could come into contact with the virus as they pass through the birth canal. This can lead to the virus being present in the baby's mouth and throat. The pathophysiology of genital warts involves several key processes. The transmission of genital warts occurs through direct skin-to-skin contact, primarily during sexual activity. Once inside, the virus targets the basal cells of the epithelium. It then begins to replicate within these cells. This process disrupts the normal cell cycle control mechanisms, leading to uncontrolled cell growth and proliferation. As the infected basal cells divide uncontrollably, they start to form raised, cauliflower-like growths known as warts. The infected cells contain viral particles, which can be shed from the surface of the warts. The body's immune system recognizes the presence of the HPV virus and responds by initiating an immune reaction. While genital warts themselves are generally not cancerous, some strains of HPV that cause them, particularly HPV types 16 and 18, are considered high risk and can lead to the development of various cancers, including cervical, anal, and oropharyngeal cancer. In many cases, the immune system eventually recognizes the virus and clears the infection. This spontaneous clearance can occur over a period of months to years. However, some infections persist, and individuals can continue to experience recurrent outbreaks of genital warts. Diagnosing genital warts begins with a thorough medical history by a healthcare professional. The healthcare provider will ask about your sexual history and any symptoms you may have experienced, such as itching, discomfort, or pain in the genital area. They might also inquire about your vaccination status against HPV. A healthcare provider, often a dermatologist or a gynecologist, will perform a visual examination of the genital and anal areas. They will look for any abnormal growths, such as warts, and assess their size, shape, color, and location. Genital warts are typically flesh-colored or slightly darker, and can have a cauliflower-like appearance. In some cases, the healthcare provider may apply a solution of acetic acid to the genital area. This causes the warts to turn white and become more visible, aiding in their detection during the examination. For individuals with suspected cervical or vaginal warts, a colposcope might be used to examine the cervix or vaginal walls more closely. This can help visualize smaller warts that may not be easily seen with the naked eye. If the diagnosis is uncertain or if the healthcare provider suspects other conditions, they might perform a biopsy. During a biopsy, a small sample of tissue is taken from the wart for further examination under a microscope. This helps confirm the diagnosis and rule out other potential issues. While not always necessary for diagnosing genital warts, HPV testing can provide valuable information about the specific strain of HPV causing the infection. This can be done through DNA or RNA tests, often performed on a sample collected from the warts or from the cervix in women. HPV testing is more commonly used for cervical cancer screening rather than specifically for diagnosing genital warts. Genital warts can be treated, but there is no cure for the underlying human papillomavirus infection that causes them. The primary goal of treatment is to remove or reduce the warts and alleviate any associated discomfort. Treatment options vary based on the size, location, and number of warts, as well as the preferences of the individual and their healthcare provider. Here are some common methods of treating genital warts, which include topical treatments such as imiquimod cream. This cream stimulates the immune system to fight the HPV infection. It is applied directly to the warts and typically used for several weeks. Pathophysiology gel or solution. This medication helps to destroy the wart tissue. It is applied by the patient at home, following a healthcare provider's instructions. Pathophyllin resin. A healthcare provider can apply this resin directly to the warts. It's a strong treatment and should not be used during pregnancy. In-office procedures include cryotherapy. Liquid nitrogen is used to freeze and destroy the warts. Electrocautery, where an electric current is used to burn off the warts. Surgical removal, in which the warts are physically cut out by a healthcare provider. This might be recommended for larger or harder to treat warts. In laser therapy, a laser is used to target and destroy the wart tissue. This is often used for larger warts that are difficult to treat with other methods. In some cases, antiviral medications might be prescribed to reduce the severity and duration of outbreaks. Regardless of the treatment method used, follow-up appointments are important to monitor the progress and ensure that the warts are being effectively treated. It's important to note that treatments might cause temporary discomfort, and multiple sessions might be necessary to completely eliminate the warts. Additionally, because HPV can remain in the body even after warts are removed, regular checkups and screenings are recommended. While genital warts themselves are not life-threatening, they can lead to various complications, both physical and emotional. Genital warts can cause itching, burning, and discomfort in the affected area. Irritation and inflammation can lead to discomfort during sexual activity, and the warts might become painful if they are located in areas prone to friction. Being diagnosed with genital warts can lead to emotional distress, embarrassment, and anxiety. Concerns about self-image, relationships, and potential stigma associated with sexually transmitted infections can impact a person's overall well-being. Even after successful treatment, genital warts can recur due to the persistence of the HPV virus in the body. Regular checkups and screenings are necessary to monitor and manage potential recurrences. While most genital warts are caused by low-risk HPV strains, certain high-risk strains of HPV can lead to cervical cancer in women. Regular Pap smears and HPV testing are essential for early detection and prevention of cervical cancer. Pregnant individuals with genital warts may experience complications during childbirth, including the need for cesarean delivery to prevent the transmission of the virus to the newborn. Warts can also grow and become more problematic during pregnancy due to hormonal changes. The presence of genital warts can potentially strain sexual relationships due to concerns about transmission, physical discomfort, and emotional factors. Preventing genital warts involves a combination of safe sexual practices, vaccination, and maintaining good overall sexual health. Here are several steps you can take to reduce the risk of contracting and spreading genital warts. Practice safe sex. Use condoms consistently and correctly during intercourse. Condoms can provide a barrier that reduces the risk of HPV transmission, although they might not provide complete protection due to the potential of skin-to-skin contact. By reducing the number of sexual partners, you can lower your risk of exposure to HPV and other sexually transmitted infections. HPV vaccines are available and are highly effective in preventing infection with the most common types of HPV that cause genital warts and certain cancers. The vaccines are recommended for both males and females, usually starting in the teenage years. Regular visits to a healthcare provider for sexual health screenings and checkups can help detect any potential issues early on. Open and honest communication with sexual partners about sexual health, STI, and vaccination status is important for making informed decisions about sexual activities. Keeping the genital and anal areas clean and dry can help prevent irritation and potential infection. Avoid engaging in high-risk sexual behaviors, such as having unprotected sex with multiple partners, which increases the likelihood of HPV exposure. Learn about HPV, its transmission, and prevention strategies to make informed choices regarding your sexual health. Maintaining a healthy lifestyle, including a balanced diet, regular exercise, and managing stress, can support a strong immune system, which is important for preventing HPV infections from becoming symptomatic. And that's all for this video. If you found this video helpful, don't forget to give it a thumbs up and share it with your friends. And if you have any questions or topics you'd like us to cover in future videos, please let us know in the comments section below. Thank you for watching. Until next time.